The minister highlighted that insufficient awareness remains a major challenge for little persons, calling for more efforts in advocacy.
According to Uganda National Housing and Population Statistics 2024, there are over 194,271, and with 89 of these, 102 are male and 169 are female. Persons aged 18 and above who are little persons.
A key area of concern remains the pervasive inaccessibility of infrastructure, which profoundly affects the short-stature persons community.
Public notices, adverts, and bulletin boards are placed high on walls for above the sight of persons with little persons, excluding them from opportunities and updates and other access. While Uganda's Building Control Act and Person Disability Act both emphasize accessibility, enforcement remains weak. Most buildings still lack reasonable accommodation. Features such as adjustable counterparts, appropriate sized doors, or ramps suitable for users of short stature. Psychologically, the cumulative impact of these barriers and prejudices is profound. Constant exclusion, mockery, and rejection lead to low self-esteem, anxiety, and depression among little persons.
The minister also noted the health risks associated with dwarfism, such as high risk during childbirth and the issues of marginalization within education institutions. The government has committed financial support, giving 50 million shillings to the Little Persons Circle.
As community health workers sometimes assume that the women with short stature are minors or asexual, and therefore ineligible for family planning. These assumptions reflect not only medical ignorance and also harmful stereotypes that undermine bodily autonomy and family planning. Little persons are still marginalized by both the system and social attitudes. In many schools, classmates mock little persons by forcing them to touch the opposite ear. And I think the media reminds, when you are going to school, they will ask you to put your hand those days over the ear. But for these people, their hands can never come to that level.
Furthermore, the government is currently collecting data through little persons advocacy groups to formulate evidence-based policies and is mandating stakeholders to support non-discrimination, particularly to increase enrollment and facilitation in tertiary institutions in line with the UN Sustainable Goals.
The human rights model, which is based on human rights. So why are we still more vulnerable is that the awareness about the rights of persons of short stature is still very low. We are not yet there to reach every person. We are not yet there to reach every community, every parent, to tell them that please, when you bear a child with a disability of short stature, it's not that needs to be, you are not supposed to be pitied, but you have to just treat this child as a child.
Dwarfism Awareness Day aims to bring attention to the issues faced by little people. Beata Muwema, NTV Tonight.